Hi, my name is Dr. Julio Novoa. I am a practicing OBGYN and cosmetic surgeon from El Paso, Texas. Today I wanted to talk about the increasing rate of cesarean section in the United States. Since the 1970s, the rate of cesarean section has gone up from 5% to the latest study suggesting 32.8%. That means that 1 out of 3 women who go to the hospital will wind up with cesarean sections. And this also includes first-time mothers. 1 out of 3 first-time mothers are being delivered by cesarean section. So we have seen a greater than 6-fold increase in the rate of cesarean section since the 1970s. Despite this, we have seen very little or no benefit to either the mother or the babies with this increase in the rate of cesarean section. So why is it that this is happening? And I saw a program yesterday where it was suggested that we're doing it, OBGYNs are doing it to make more money. And that's a cynical way of thinking of things, and I don't really believe that that's the case for the majority of doctors. But what I do think is happening is that, unfortunately, doctors are fearful of being sued. We live in a society where if everything doesn't come out perfect, people are pointing fingers at one another, and unfortunately, when it comes to babies, they're going to be pointing their fingers at their doctors if the doctors have not been able to provide a very good or perfect outcome on a delivery. And therefore, it's so much easier for a doctor, fearful of having a problem, complication, or a lawsuit, to do a cesarean section rather than attempt the more complicated vaginal delivery. And I understand that because I deliver between 20 and 30 babies per month, and I've delivered over 5,000 babies since 1999. But I've been practicing like I was taught in my university setting, and I'm happy to say that my primary cesarean section rate is approximately 7%. And the reason for this is that I continue to practice the way that I was taught. I continue to practice, by most of the time, by the recommended guidelines by the American College of Obstetrics and Gynecology. And I do it because I hold myself accountable for how I practice, and I believe that if we did that, we could find a final stop to the point where it becomes so much easier to do a cesarean section and we're actually become accountable for our actions. I do understand the pressures of the lawsuits. I do understand that very, very clearly because of the number of deliveries that I do. But as a common saying is, if you can't stand the heat, get out of the kitchen. Well, that basically is how things should be handled, because we're not looking at ourselves. We're looking at the benefit of our patients, and that's very, very important. And I think that the majority of doctors do really want to do that. And because of that, if we have peer review, if we have accountability, we're going to see that the rate of cesarean section can decrease. And one of the most common things why the cesarean section rate is so high is one particular reason, and I think, as far as attempting the vaginal delivery from an induction, an elective induction. So what does that mean? An elective induction is when a doctor allows a patient to go into the hospital or sends a patient to the hospital and gives the patient medicine which will provoke contractions, which will lead to labor, which hopefully will end with a vaginal delivery. Unfortunately, most patients don't understand that the risk of a failure of an induction leading to cesarean section can be as high as 50%. So we're talking about a 50-50 chance of winding up with a cesarean section if you electively induce. And a lot of patients have not been told this. So if we stop doing elective inductions, or at least advised our patients what it means to attempt an elective induction, then maybe the patients would wait, or the patients would want to wait until they actually go into natural labor. And I believe that this would be one significant way of reducing the rate of cesarean sections in the United States. Other reasons which are commonly given are almost always associated with physician discretion. And again, if the physicians had to explain on the majority of their cases if their cesarean section rate was above the recommended 15% by the World Health Organization, and I agree with the 15%, because if you look at the university settings, you're going to see that most university settings have a rate of primary cesarean section below 15%. while in private practice, the rate of cesarean section is double that. So why does that happen? It's because in the university setting, the soon-to-be private practicing doctors are accountable to their attendings. And I believe that we need to have that type of motivation again, where we have to have an explanation as to why we're sending a patient in for an elective induction, or why we feel that it's a non-reassuring fetal heart tracing. Now, there are going to be circumstances where absolutely a patient should be delivered by cesarean section, such as a breech presentation, or placental abruption, or prolapsed cord. These are obvious reasons why we should be doing emergency cesarean sections or elective cesarean sections. But non-reassuring fetal heart tracing and failure to progress are two of the most common physician discretion diagnoses, which I think we need to evaluate a little bit better. When we do this, when we hold ourselves accountable, we put ourselves up so that our patients can see what our track records are, I think we're going to see a vast improvement in the overall rate of cesarean sections. For that reason, I post my statistics online so my patients can see what my rate of cesarean section is every month. How many deliveries do I do? What are my complications? How many cesarean sections do I do? And this is very important. I think when you hold yourself accountable and when you present that to your patients, you become a better doctor. You are a better doctor. And you're not holding anything back. Now, I don't have a problem with doing elective cesarean sections. If my patient says, you know what, I don't want a vaginal delivery, I want to be delivered by cesarean section, and even if she's a primary or a patient that's never had a previous cesarean section, as long as she's given proper informed consent, I do believe that that you can do a cesarean section if the patient has been properly informed. So with these considerations, I hope that you, as my patient, will address these particular issues, and in general, if you have friends or family members that are pregnant, will address these particular concerns and try and help us reduce the rate of cesarean section from almost the 33% that it is right now back down to at least 15%, which is recommended by the World Health Organization. I hope this has been a good piece of information for you, and keep in touch with us through our website at www.drnovoa.com or through our email addresses at firstchoicemedicine.com. Thank you very much.